Good evening, everyone. I'm AnnMarie Cronin, and I'm hosting our weekly special live broadcast on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to tell you what you need to know about how to avoid heart attack and stroke altogether, and what you need to do to prevent Alzheimer's and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. Again, that number is 800-859-0957. We'll be repeating it throughout the show. And now is your chance to talk directly to the doctor. So stay tuned and we'll be right back. You're listening to News Talk 760 WJR.
We're on Facebook.
Okay,
We're on
so
Facebook. Oh my gosh.
Yeah,
Yeah.
we're on Facebook Live now. So let's see, what are we going to be talking about in this episode?
Well, we're going to start with Aaron Rodgers, who's if you don't know,
Do you know who he is, Siobhan?
I'm
Aaron-
not familiar, I don't think.
He's a musician. He was like conducting the major Boston Symphony Orchestra a few years ago. You don't know who he is?
Maybe I do then. I'm not sure. I'll have to look him up.
Okay, that's a joke. He is some
What?
kind of football player. And that's why
Yeah, okay.
none of the musicians know who the hell they're talking about. But see, that doesn't surprise me that she doesn't know. Good for you, Siobhan. I'm proud of you.
she's
Not
proud
that
of
you
you.
should be proud of that.
Right.
No.
Well, so what's the story?
Well, he lied that he was not vaccinated, and then he got COVID, and thank you.
I did hear about this. I remember seeing it on the news. I didn't remember the name, but I'm familiar. But go on, yeah, for the listeners.
Well, we're just going to talk about, that this is a non-vaccinated person who didn't need to be hospitalized or die from COVID.
Well, there's a lot of non-vaccinated people who didn't get hospitalized and died from COVID.
Well, you wouldn't know that by the news, where all the news is about getting you to be vaccinated, and there's still no discussion about early treatment. So instead of making this a story about an opportunity for early treatment, the news turns this into castigating him.
Mm-hmm.
When it should be, what'd you do? Give us your recipe. How'd you do this?
When am I back? How come I don't have a time
You're
sheet?
back
We're
in
back
about
at,
a
we're
minute.
back at 7:09. Yeah, so it's
5
I'll get to
seconds.
set some time.
Again, I'd like to welcome all of you to our special weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are here tonight ready to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957, or as WJR has informed me to say 800-859-0WJR. Dr. Kolender, always a pleasure having you here talking to everybody in America who's listening, and they're able to call in and talk to you. What is the news today, this week? What's on top of your mind?
Well, thanks, AnnMarie. I thought we should talk a little bit about Aaron Rodgers, who
Well,
apparently...
let's talk about who he is,
well,
first
everyone,
of all.
the listeners know, everyone in the listening audience knows except you.
No, that's not true.
It
All the
is true.
musicians don't know. Siobhan
apparently.
didn't know.
All right,
Siobhan's
well,
online. She's a musician.
That's not
She
what the
didn't know.
show's about.
Fine.
All right, so the listeners know that he's one of the most famous, successful, talented quarterbacks who we hate in Detroit, but nonetheless, he did not disclose that he was unvaccinated to the NFL, and he got COVID, and he did very well. And he consulted Joe Rogan, who's a podcaster, who's got probably the most popular podcast in the country, who also got COVID and used his own regimen to recover. And so I think the real story here is not that somebody lied, posed as being vaccinated for his job and wasn't.
Did he get fired? Wait a minute. Did he get fired?
No one's firing him.
Okay.
It's like firing
It
the
was a
Pope.
mandate.
They had was it a mandate? It was a requirement. So essentially a mandate.
Same thing. Okay. A lot of people were
So-
fired from Beaumont Hospital for not getting the vaccine, but let's go on.
So he got fined at the end of the day. He got fined for not following the NFL COVID protocol, but he would have written that check on day one if he would have known, hey, do whatever you want, write a check for $15,000 and don't worry about it. He
Mhm.
would have written that all day. And frankly, I think a lot of athletes might write that check if they knew that was an option. So he gets castigated by the news for two things. Number one, not being vaccinated and lying about being vaccinated. I think the real story is that here's a non-vaccinated person that did not require hospitalization and did not die from COVID. And the messaging from the news is that someone like that is totally responsible for every COVID outbreak in the country. So that really should be what the news is.
No, I agree. So what you're saying is the most important thing is that if you get COVID, it's immediate medical care, it's immediate intervention, and not going to the hospital.
Well, that's what we talk about. You got to call. Go ahead.
We did have a caller come in. Okay, let's jump to Karen in New Baltimore. Karen, what's your question?
Yes, I want to know the inequalities. Now, I just heard on the radio that all the employees for Pfizer, Moderna, and Johnson & Johnson, they don't have to get a vaccination. And then how come other people do and they don't? And then somebody quit their job at Johnson & Johnson and said, oh, they quit their job. They said, I don't want this vaccination. I wouldn't give it to a dog. Now, those were his exact words. I'd like to know what's going on. What are all these inequalities?
Well, thank you for calling. And I do share your concern and confusion about what's happening. And there's a rumor that I've heard that also that, the employees of these pharmaceutical companies and the government are not being mandated to get vaccinated, whereas the rest of us are, depending on your job. So I think the important thing, and AnnMarie would agree, is to talk about what can you do? Because we don't really have the power to go against the government and fight City Hall, so to speak. But, we're here to educate you about what can you do in the face of, we use the word tyranny, to save yourself from COVID, stay healthy, and, get through this in the best possible way.
Well, I think the most important thing is, as we talked about last week and we've talked about before, is like, if you get diagnosed with COVID, the last place you want to go to is the hospital, and that you want to be treated immediately. And that's not going to happen if you go to the ER. So I think people need to be less worried about mandates and who's getting fired and who's being forced to get a vaccine and who's not. That is totally immaterial. What is material is that when you get diagnosed, what is the next step? And
Well,
so
again,
let's come back to Aaron Rodgers.
Exactly.
So what happened with them?
Well, that's exactly what I was
Since
saying.
I don't know anything about sports, I'm like behind the 8 ball
Well,
here,
this
but go ahead.
isn't a sports story. It's
No, I
it's a
understand.
medicine story now. We should be asking Aaron Rodgers. I know what I do, and I know what I offer all my patients. And I know what I do, but I want to hear what Aaron Rodgers did.
Right, exactly. And so we don't have any possibility of asking him, obviously, but he wound up surviving.
He's fine, but that's really the story is, what do we have to do to keep ourselves out of trouble? And, this is an example of a layperson who put together a program, culled together from other people who've survived COVID and, did really well. This should be a story about, hey, here's what I did. Have him educate the public. He's got the ear of hundreds of millions of people. They'll listen.
Absolutely. So it's not about whether you got vaccinated or not, but what you do if you get diagnosed. In the meantime, we've got to take a short break. And again, you're listening to a special live broadcast, and we are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent catastrophic disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live until 7:19, so we have about 3 minutes.
So what is going on with the noise in there?
You know, will you go and tell them in an unpolite way
Here
that
we
they
go.
gotta go?
What?
You gotta. We can't hear what we're doing. The noise in there from
Talking is in
Gary
there.
is screwing us up badly. Right. So have Gary talk on his time. No, it's off. Okay.
Okay, fine.
I'm not getting that, so I missed
Right.
out on
Oh,
that.
yeah.
The perks
No,
of
we
remote
couldn't hear.
broadcast.
Yeah,
We
right.
did, by the way, have another caller come through that we'll catch on the air. So
Who is it?
I'll put someone from Southfield, Danny from Southfield, but we'll wait till we're back on the air.
Okay,
No,
so
but
I
this is an
think
interesting topic because, like, I texted Dr. Kolender a couple days ago because, you know, we're all talking about getting the boosters and being on tour and how do you protect, you know, all the people that are around you from what happens if you get COVID and whether it's worth getting the booster. And he said, well, there's, you know, better treatments now, so it might not really help you that much.
Well, you know, there's a
Right?
place for, there's a place for boosters. And in my opinion now, if you feel you need to get a booster, get a booster. They're available.
but they're not harmful, right? I mean, they can't be harmful.
Well, there's a theoretical place where they might be, and I'm saying theoretical. So, you know, we're asking our immune system to, you know, fight a disease that frankly doesn't exist anymore. So this booster is made for the alpha variant. It's gone. And you're using it against another virus that has partial activity. And so, and this is a good question for the show, I think. And, you know, I wouldn't use an antibiotic this way. You know, I wouldn't use an antibiotic on a bacteria that has partial resistance, because then I'm going to create more drug resistance.
Right.
And so maybe we're, you know, asking this virus to mutate in a way so that it's resistant to this vaccine by providing, you know, an evolutionary stress to it. So it might be unsafe to use this vaccine in an ongoing way. And, you know, so, you know, do I know 100% why? But, you know, I wouldn't use a drug that only works a little bit.
Sure. Makes sense.
I think it's bad medicine.
When are we back?
We're back in less than a minute. We have 2 callers. One wants to remain anonymous.
Okay.
So now 3 callers.
Okay.
We have one of our regular callers is calling in again.
If you're just now joining us, I'd like to let you know that we're welcoming you to our special live medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. He's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. And we're inviting listeners to call in with your questions at 800-859-0957 or at the request of WJR, that's 800-859-0WJR. Dr. Kolender, you started the show talking about Aaron Rodgers. He misrepresented getting vaccinated, but the bottom line, and let's cut to the chase, and I know we've got 2 callers, Siobhan, don't flip out. I just want to, you know, lay the groundwork here that the message is getting treatment. It's like if you get diagnosed, it doesn't matter whether you were or were not vaccinated. I think the message that you're trying to say is, minute you're diagnosed, you've got to know where to go, and it's not the hospital.
And you got to get diagnosed.
You've got to get
Don't
diagnosed.
sit at home thinking you're going to cut it out.
It's
you're
immediate.
Sick, get an immediate test.
Okay, Siobhan, go ahead.
Okay, so we have a few callers on the line. Let's start first. We have an anonymous caller. Caller, what is your question?
Hi, actually, I have a comment. Hi, Dr. Kolender. I am actually a local area sales representative for Pfizer. So I just wanted to comment on what the prior caller had said regarding the inequities with vaccination with my company. And with Pfizer, we did have a vaccine mandate. However, there were medical and religious exemptions. So we're kind of the same as a lot of other corporations. I had
Okay,
COVID
wait.
in
I'm
October
going to
last
jump.
year.
Hold on. I'm going to jump in here. I know that you're a Pfizer employee, but what is your question for the doctor? Because we have a lot of callers that we need to prioritize their question. What is your question?
I did not have a question. It was a comment regarding the prior caller because she had a question about inequalities. So I was just clarifying Big Pharma, what the actual vaccination rules were, that we are mandated just like everybody else.
Well,
Okay.
thank you for calling.
Thanks for calling. Who's the next caller?
Okay, up next we have Danny in Southfield. Danny, what's your question?
My question was to go back with Aaron Rodgers in terms of him speaking with Joe Rogan. I know that Joe Rogan was taking a lot of vitamins and ivermectin. Just wondering if that's a recommendation. This ivermectin I know is controversial. Is this something that I should reach out to telehealth doctors to get a script for?
Well, I think among other things, ivermectin is a tool for managing COVID. And so I don't use it as much because I've been having a hard time getting the prescription filled. But if you are able to get it filled, as either a prophylactic or, when you're having COVID, again, it's not on its own, it's part of a program. And I'd say my program includes getting monoclonal antibodies. So I'm using supplements and hydroxychloroquine to, just say hold people over while they get a monoclonal antibody therapy. So you could use ivermectin instead of hydroxychloroquine in that case.
Okay, I know that we've got callers waiting, but I just wanted to weigh in on this. The most important thing is that whenever people get diagnosed, they need to hook up with a doctor or a clinic or somebody who's going to know how to treat them. That's the bottom line. They want to survive. They want to live. They don't want to wind up in the hospital. And so, debating upon this medicine, that medicine, they need to get to a doctor who's going to shepherd them through the process, because that's what you guys do. You're healers. Am I right or wrong?
You've got to agree. You've got to get tested the moment you don't feel well to make sure it's not COVID. And then you have a decision tree after that. But now you got to know where you are.
Right. Siobhan, we're
Absolutely.
holding.
Okay,
Go ahead.
up next we have Pat in Richmond. Pat, what's your question?
Hey there, Pat. Are you still with us? All right, let's take the next caller.
Okay, maybe we'll circle back around. Up next after that, we have Marcia in Waterford. Marcia, what's your question?
I have worked through this entire pandemic, well, plandemic, whatever you want to call it, because I don't really believe it's a pandemic, first of all, but I've worked through this entire thing in extremely high volume retail. I have not gotten sick. I want to know why nobody is preaching taking care and doing preventative measures, taking vitamin C, taking vitamin D, taking a zinc, eating healthy, exercising, working on eliminating comorbidities. I don't hear any of that from the medical profession, and all I hear is fear-mongering from our government, and I want to know why they don't push
Well, you got Dr. Kolender.
Well, welcome to the show.
He preaches that every week, twice a week on both shows, preaching it all the time. Absolutely. Go ahead, Dr. Kolender.
Well, obviously the government has an agenda to make sure everybody gets vaccinated, because if they did not, there would be talking about, what do you do if you get COVID? When you don't feel well, get tested right away. And even if they don't believe in hydroxychloroquine, vitamin D3, zinc, quercetin, maybe a little bit of steroids, using an inhaler, Pulmicort, which helps, has a study behind it and has not been given emergency use authorization for COVID. They still have approved monoclonal antibody therapy. And if everyone got a monoclonal antibody therapy within 48 hours of being diagnosed with COVID, guess what? No one would be in the hospital, and we wouldn't have to be talking about any of this. So maybe, Regeneron didn't pay enough, to the FDA. Their fee for getting the emergency use wasn't high enough, so they didn't reach that threshold.
I mean, it's unbelievably pathetic to think about the fact that people have died by just getting diagnosed and going to the ER and going into the hospital when there are so many other remedies out there for cure.
Well, I want to talk a little bit about a patient, who I saw this week. He's fine, didn't end up in the hospital, but he called, Henry Ford to get onto the monoclonal antibody therapy. And by the time they called him back, the window of treatment had closed.
Boy.
I mean, so it turned
What do you
out
mean?
he
Wait,
went
Lloyd,
okay.
let's back up. Do you know what the window, I mean, how long did he wait to get called by Henry Ford?
He called right away, but it took more than 10 days and the window's 7.
10 days?
Yeah.
You must be
That's
joking.
wild.
Are
Yeah.
you kidding me? Henry Ford, are you listening? Wake up, smell the coffee. That is not acceptable.
More chairs.
That is not, how is that possible?
Well, the answer is it must not make enough money to do monoclonal antibody therapy.
No, I forget about
I
whether
know,
they're
well-
doing the therapy or not, but how about responding to the patient's call? People are dying. Do you care, Henry Ford? Are you listening? I mean, 10 days to return a phone call? Is that acceptable on any planet?
No, it's terrible. When this is the thing that keeps people out of the hospital, I'm pretty convinced that the system as it is doesn't want you they want you in the hospital. They're going to complain about the hospitals being full, yet do nothing to keep you out of the hospital. And then blame it on people not being vaccinated.
Well, I mean,
that's all the messaging online is. And the messaging should be, you got a sore throat, you got a low-grade fever, you got muscle aching, any of the symptoms, shortness of breath, cough, get a COVID test right away. Or you got a COVID test, go get your supplement package, get your ivermectin, get your hydroxychloroquine, set up an infusion, and you're fine. No one goes to the ER.
okay, we're going to have to switch away from this catastrophe, unfortunately, and we'll take another call. Go ahead.
Yeah, if we
Siobhan.
have time. So quickly, we have Kevin on the line from Williamston. Kevin, what's your question? You've only got about a minute.
Well, thank you. Can you hear me okay?
Yes.
Yes, sounds good.
Okay, real quick. By the way, love your program. You guys are awesome.
Thank
So
you.
here's the deal. I got COVID back in December 2020, and it lasted about 7 days altogether for me, 7 to 10 days, and I did every single thing you're talking about, everything except for the monoclonal antibodies. Situation is, I got over it, did really well. I'm 59 years of age, and I want to ask you, my natural immunity is amazing as far as the antibodies. It came in at 105 ml, whatever that means, but it was pretty high from what I was told. And I've been around my wife, my daughters, my grandkids, and everything, and helping them through the process with COVID, and I never came down with it again. So my antibodies, I think, are a firewall to the COVID.
Well, sorry, we're at the end of the segment, but we'll bring this up next segment.
When we
Hang on,
come back,
please.
Dr. Kolender will answer your question. But in the meantime, we've got to take a quick break. Again, you are listening to a special live medical broadcast. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
The new school year has begun in local schools all across
Okay, so
Michigan.
we're back on Facebook Live on the air again at 7:33, and let's quickly say hello to our South Korean listeners. So hi to everyone that's listening
Yes.
overseas and abroad. Thank you for tuning in.
They get upset when Facebook crashes or we don't have our Facebook. They're sending me emails saying what's going on, and I do have some emails that I have to answer, so I'll get to that tomorrow. But I mean, that was amazing. I mean, I cannot believe what you just said. 10 days. Are you serious?
Well, we talked about this last time, that patients are calling Beaumont and they can't get through, and Beaumont's referring them to other places. At least they're referring them, but that doesn't mean that some people are not being, left on the hook with nowhere to go. So why, and then again, I don't have an answer for this, but why isn't there an infrastructure involved that allows people to get a treatment that is pretty safe? I mean, I don't say pretty safe, but really safe, and keeps you out of the hospital. And, everyone's knocking DeSantis in Florida, but he's got a statewide network of monoclonal antibody infusion centers keeping people out of the hospital.
Unbelievable. I mean, it's just amazing to think about what bad shape we're in here. How is this possible? I mean, I called Henry Ford Hospital to get through to one of the doctors that I wanted to interview the other day. 45 minutes going nowhere, getting transferred from A to B to C to D to E to F. And that's me that has some access into medical journalism. God help the patients. And that was my message to them. But a patient calls and waits 10 days for an answer back. How do we accept this as being okay?
Well, we know that our healthcare system is completely broken.
This is a hospital that's completely broken.
They're part of the healthcare system. The hospital system is, really a major player within the whole system that we have. They're all in cahoots. The pharma, insurance, the FDA, Medicare, they're all integrating together to make money for themselves, at the expense of the government. Really, Medicare is the biggest insurer, and it's just like a cash cow to these systems. And so if it makes more money for people to get vaccinated and to be in the hospital, well, then that's where they're funneling everybody.
I mean, I don't know what to say. This is absolutely ridiculous. This is one of the major hospitals in Detroit, one of the major hospitals.
So, Siobhan, I think, going back, if you will, we'll answer this guy's question about natural immunity when we come back. But if you want to go about your, booster, right? I'm reason to love it.
Asking about the boosters.
It's worth discussing because people are still going around not quite knowing what's helping, what's not helping, just doing what they think they should. And
I'm getting I'm getting texts all day about, do I get a booster? Even though I've emailed the practice of, here's my opinion, they're not all looking at the email. I got to send it again. And so
we do have more callers coming in too.
All right, good. All right. So we'll do quickly.
So far 2, 1 in Canada. So.
All right. I'll answer Kevin quickly. You may have to do a quick.
Well, he's probably not still on the line.
No. We'll just.
No, but you can just say he's not on the line, but whatever. Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about 2 important topics, prevention and being proactive. We're inviting you to call in with your questions at 800-859-0957. Again, that's 800-859-0957. And before I hand the mic over to Dr. Kolender and Siobhan again, I want to let listeners know, please tune in Sunday at 3 p.m. Dr. Kolender has a weekly show, very full of information. It's not a live show, but we're encouraging you to listen to it. Tune in Sundays at 3 p.m. Coming back, Dr. Kolender, do you want to follow up with Kevin's question?
Yeah. So, Kevin, just to reassure your, how you felt about your situation is natural immunity is better than vaccination immunity, and it lasts longer and covers more variants. So natural immunity is always a better option right now. And there's a lot of studies out of Israel that have promoted this to this effect. So if you've been vaccinated, we're going to come back to callers, but we'll come around to this. But if you've had COVID, I don't really see a need to get a booster because your immunity surpasses that of a booster, at this time. So, how long that immunity is going on, we don't know, but it's certainly lasting longer than getting a booster. So I had COVID in the beginning, a year and a half ago in March of 2020, and I'm around COVID all the time.
Sure.
And I don't have a sniffle.
Right.
So I don't even worry about COVID at all anymore, having had it. And I don't feel like I need a booster.
Okay, so do we have other callers,
Yeah, so
Siobhan?
let's jump to some callers. So up first, we have Linda in Clinton Township. Linda, what's your question?
I have a question about what the doctor would recommend for prevention of COVID. I did have COVID in April, and I got the monoclonal, and it knocked it out of me. It was like a blessing. I have not had any vaccines. I don't feel like I need them at this point, and I'm hoping the doctor agrees with that. But I would like to start taking supplements to maybe prevent a possibility of getting COVID again.
Well, thanks for calling. And, for when you're talking about, you've had COVID, I agree with everything you said. You have natural immunity. And I would agree that you should not need a vaccine at this point because you have better immunity than anything you're going to get from a vaccine. Now, as far as prevention, the best prevention you should do against COVID is not necessarily supplements because you're immune. You need to learn about prevention for life, which is identifying disease and putting together a personalized health plan to prevent other chronic illnesses. And that's how you continue to boost your natural immunity. So who knows what supplements you need without doing a full evaluation of your health profile?
Okay, Linda, thanks for
Yeah.
calling. Siobhan, who do you have next?
Okay, up next we have Rose in Ontario in Canada. Rose, what's your question?
I was a registered nurse and a public health nurse. I have very many allergies. I'm allergic to vaccines. Even when I got a flu shot, I would react within 5 minutes. So I don't know what to do other than stay home and stay away from everybody.
Well, again, going back to prevention, Rose, you want to be healthy. You want to eat the right foods for you. You want to exercise. You do want to socialize because that's a healthy thing to do. And, identify your risks for chronic disease so you can address them while you're healthy and boost your own immune system. That being said, everyone should be taking vitamin D3. They should be taking zinc and, work on building your natural immunity, not necessarily with supplements, but just with healthy lifestyle. But get testing that identifies your risk, vascular risk.
Yeah, very important. And again, we can't stress this enough that patients really need to know what their profile is and what they need to get in touch with a doctor, like the practice that you have of prevention, where you're doing all these tests and identifying what the risk is.
What I'm hearing from the callers today is the kind of the moving on from COVID. I've had it, now what do I do? I'm immune, what do
interesting.
I do? It's just the tone. I'm allergic, I'm not getting vaccinated, what do I do? Oh my God, how do we get through this right now? It just feels like the calls today are really, I'm over it. Like, now what? And the now what is get back to basics, screen for your vascular health because it's objective, and then use that information to root out all of your other drivers of chronic disease and address them. And this way, should you get COVID, you're healthy enough to deal with it.
It's interesting how many people call in and ask the question. They've already had COVID, so therefore they've got antibodies, and we're still getting calls, from people that are still afraid of it. And also a lot of the other callers and inquiries are about whether or not they should get the booster shot. So is there any real fear if you've had COVID, if you've been vaccinated, that you're going to get it again? And how dangerous are these other variants?
Well, so far, the predominant variant out there right now is Delta. And it seems that if you've had COVID, you have pretty solid immunity against Delta. Unfortunately, the vaccines are not holding up against Delta. So we're having breakthrough, even if it's not a severe breakthrough, we're still having breakthrough on vaccinated people, in which, Siobhan asked me, she sent a text, should she and Brock get a booster? And my answer is not yet. And the reason is they're healthy. Granted, they don't want to miss tour dates for COVID, but I don't know that getting a vaccine that doesn't have significant efficacy against this Delta variant is going to help her from getting COVID. She might get it anyway. Granted, it may not be as severe, but they've been vaccinated. Don't mind me sharing this. They've been vaccinated.
Sure, yeah, of course. Yeah.
They've been vaccinated. So they have some coverage, which was the right move for a year ago.
Mhm.
But things have changed. That was Alpha variant. Now we're on Delta variant. We don't have a new vaccine to handle just Delta. We have a lot of treatments as outpatients to manage. And now we have 2 more. Pfizer is coming out with their pill, their anti-COVID viral pill. I hope it's safe. And Merck is coming out with their COVID antiviral pill, and I hope that's safe. So I have no idea if they are or not. The studies have not been published, but let's pray that they are safe.
Well, we hear this question a lot from people that have had COVID. They're worried about, oh, the new variants out there. Am I going to get COVID again? And if I do, I mean, how sick will I be? So I guess what you're saying is, if you've been vaccinated, then probably if you get COVID or you've had COVID and you're going to get it again, it's not going to be as strong or it's not going to be as fatal, I guess, is the question.
I'm saying that if you've had COVID, you have natural immunity. So far, you should be fine. I don't know that there's any significant cases of people in the hospital from COVID that had COVID.
Well, we could take this one quick call
Yes,
right
we
here.
have just a couple minutes. We have Mike on the line in Ohio. Mike, what's your question? We're coming up on the end of the segment, so if you can be quick.
Hello, yes?
Yeah, hi, Mike.
Hi, Mike. Are you on the line? What's your question?
Yes, I know a gentleman that got COVID, 60-something years old, felt great, but he wanted to go on vacation, and he needed to take the vaccine. So we went ahead and did the vaccine, but then his immune system triggered to attack his spinal cord and made him paralyzed, and completely lost control of his lower functions. I'm curious on how serious something like that can be and how often.
Well,
We're going to have to talk
next.
about that on the other side of the break, unfortunately, right now. You're listening to a special live broadcast from the studios of Startup Nation in downtown Birmingham. And if you have a specific question on the subject we're discussing tonight and you would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
Well,
So
that's tragic. What he was saying is that someone he knows had COVID, in which my suggestion would be that he's immune, and then he had to get vaccinated to go on vacation wherever it was he was going, and he had a vaccine. An injury,
adverse reaction. Yeah.
and with paralysis.
Wow.
So, it depends how this is spun. It depends what station you're listening to. If it's Fox, it's a vaccine adverse reaction. If it's CNN, he had COVID.
Mm-hmm.
He's unvaccinated because the vaccine didn't settle in yet. You're not vaccinated for a month after you receive the vaccine, which means these injuries are not being tallied up as vaccine injuries. That's the problem. So we'll obviously answer that on the air, and try to be uncontroversial. AnnMarie, is that okay?
Yeah, controversial. No, it's not. Controversial is good. Political is bad. I mean, that's the whole issue, because it doesn't matter what side you're on. This is not about Republican, Democrat, right, left.
No,
not got
it's
anything.
medicine is medicine.
Medicine, exactly.
But this,
yes, hurrah.
We'll do our best not to be political. Feel free to interrupt if I get political answering this question.
Okay.
I'll do my best not to be political.
The screen will go dark,
Yes.
and then you just won't
my
be.
mic will go off.
Your mic. It is mic, exactly. But anyway, when are we back on?
47 after.
Oh, 1 minute.
So.
Okay.
No, you've got about two
Wait.
and a half.
Oh yeah. Okay, I'm looking at the wrong clock. Okay, sounds good.
You need to have one right clock rather than two wrong.
No,
clocks.
I mean, that's what I'm looking at. Clock on the left is one thing. Clock on the right is like 8 something, and so we'd be long gone.
Yeah.
Well, and it's 2 minutes faster too.
And then it's exactly.
Okay.
It's not even close. So it's like,
because Mark knows that you need to be ready. You need to be told early.
all right, he's prepping me up to be ready to jump in. But I know my cue. My cue is the music. That's all I can tell you. That's it. He used to be giving me signals like 30 seconds, 60 seconds. Now he's just given up. So anyway, so what are we coming back? We're gonna ask.
We're coming
Well,
back
we need to come back to that call.
Yeah.
Right. We're gonna answer Mike's.
Vaccine injuries.
My God, that's a whole. Don't tie up. That's your last
I'm not
segment.
quick. I'm just going to refer them to other people who are deeper into this than me. I'm not going to support the vaccine injury. I'm not going to carry that flag too much.
Right.
We have another call that came in too. Actually, it was the person that we couldn't get earlier, so he's back on the line.
So what's his name?
Pat in Richmond. He's called a few times
Yeah.
before.
Oh, he is? Okay. We've got the same
Mhm.
callers all the time. Oh, yeah, that's right.
Not always, but there are some return.
I didn't take a swipe at Olivia, but I didn't.
What?
I'll leave Olivia alone today.
Gross. They're all from Gross Isle.
Give her a break.
We're giving her a break. Thank you. 30's funny. Welcome back to the final segment of our special live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources that are available to prevent and treat the chronic and debilitating diseases we've come to accept as inevitable. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that number is 800-859-0957. And before we close the last segment, I just want to let callers know that you're always welcome to call Dr. Kolender directly at 866-Kolender. That's Kolender. And also, please tune in to the Sunday show for more information, 3 p.m. every Sunday, as well as the weekly show on Thursday at 7. Dr. Kolender, you want to answer Mike's question from before the break?
Yeah, so Mike from Ohio called and described a friend of his who recovered from COVID, then got a vaccine in order to go on vacation, and it sounds like he suffered a catastrophic vaccine injury with paralysis, probably from transverse myelitis, which is a viral inflammation-induced spinal cord injury. So, my concern and the reason I become skeptical of vaccines in the last 3 months, again, vaccines are for some people. If you are over 70, get a vaccine. If you have chronic illness and your health is not in great position, get the boosters. But I'm concerned that the government has been, that we've been missing the story of vaccine injuries to consent people properly on their risk of getting a vaccine. So I would recommend people check out Ron Johnson, Senator Ron Johnson from Wisconsin. He's got a lot of content on social media interviewing survivors of vaccine injury. And there's an attorney named Aaron Siri, SIRI, who's representing the participants of trial studies who've suffered vaccine injuries, and their cases have been removed from the study. So studies that are supposedly safe and effective, the injured people from the vaccine are not in the study. They're not included. So in fact, especially in the 5 to 11-year-old group, one child had a severe adverse reaction from the vaccine and was removed from the study. So now it looks like it's a free and clean study. It's not.
Well, I mean, we have another caller, so we should probably take the caller first of all. Go ahead.
Yeah, so let's jump to Pat in Richmond. Pat, are you on the line?
Yeah. In fact, my
Hi, what's your question?
kind of relates to this. Can you hear me?
Yep.
Yes.
Yep.
Okay. In regards to the VARS, the Vaccine Adverse Event Reporting System, does Dr. Kolender feel it's woefully underreported? Because I've talked to physicians, a lot of them have not been trained adequately in how to even utilize that system. Furthermore, the public has to work in conjunction with the doctor if there's an adverse event. If you think about some little old lady and her husband gets shot, 3 days later, maybe one of them dies of a heart attack. She's distraught. What's her chance of calling up the doctor. Hey, he had could it be the shot? And perhaps the doctor doesn't even want his fingerprints on that kind of situation. It would, no, it wasn't the shot. I mean, how do you really do an adequate, good job of reporting on this VARS and make sure you've got good data so you can make good informed decisions as a citizen?
Well, thank you for calling, Pat, and letting the audience know that this is available, that this is the VAERS Vaccine Adverse Events Reporting System, which has been available for years for citizens to report vaccine events that they experience from all vaccines. And the FDA is supposed to use this data as a signal for problems related to these vaccines. And obviously there's ridiculous signals from the COVID vaccines that seem like they're being ignored by the government. And again, this is a whole other show to talk about what that might be, and we may never get there, but this is my concern. One of them is that the vaccine should be limited to people who really need them, which is older people at higher risk from death from COVID, younger people who have chronic severe illness that would not do well with COVID. And as far as young people, only young people with severe comorbidities and chronic illness. Other people, which is a large majority, would probably do okay and survive COVID without even going to the emergency room with early disease identification, early treatment, and access to monoclonal antibodies by day 3. And then you have had COVID, you're immune and pretty much safe moving forward.
I think the most important thing is that people need to know what they do when they become sick, how very important it is to get the test right away to find out if their illness is COVID positive, and then immediately get into treating it, which is what you've done with all of your patients. As I've mentioned, of the hundreds of patients you've treated, none of them have died. None of them went to the hospital. So therefore, we have to believe that the treatment protocol that you're instituting with patients, your patients that get COVID, works, as it does with many of the other people out there. But they really need to know that first stop is not going to the hospital.
This shouldn't just be coming from you and me, AnnMarie. This should be from the state and the federal government should
but
be.
But we can't rely on them. We have to rely on you.
I know, but I'm saying I'm here to tell people what to do. The problem is they still don't have someone who's going to call, who's going to answer the phone and give them the supplements, prescribe the drugs, and direct them and write the order to get into a monoclonal antibody infusion. And again, we don't even know what these pills are yet, that are coming. And maybe they'll be available, maybe they'll be covered, maybe they won't. So I don't know. And again, the data's not out on them, so I'm not prepared to comment on whether they're safe or not, or whether or not they work. We may not even get those studies. Anyway, we can tell people what to do. They still can't, there's still no one to call and answer that call. So the state is the one who's able to set up this infrastructure to make it happen. But apparently that's not.
Well, forget about the state.
We have to forget about it because they're not acting.
You're on your own here. They're not acting, and neither's Henry Ford Hospital, obviously, when they take 10 days to answer a phone call.
They actually took government money to serve lesser served areas with monoclonal antibodies. So they got a grant from the government, hundreds of millions of dollars for their underserved area clinics, and they still don't answer the phone.
10 days.
What they do with that money?
I know, right, exactly. So we're welcome to hear back from Henry Ford when you're ready to answer that question. We'll be ready to listen and to let the listeners know. And in the meantime, again, I keep coming back to the same thing. People need to they need to know that when they feel sick, they need to get tested immediately and avoid going to the hospital and get back with their doctor. And if their doctor is not going to do anything for them, call 866 Kolender. Dr. Kolender will be glad to find a way for you to get to the treatment that you need to get in order to overcome this disease, because he's obviously proven that you can overcome and pass through this COVID disease. Am I right?
My staff's going to love you.
Oh, they really? Well, never mind about your staff. But
They're
I mean,
going to
it's
love
true.
you.
Facts are facts. I mean, none of your patients have died. None of them went to the hospital. You're treating them. You treat them individually. You've got your cocktail of different medications that you give them, and it's working.
Yes.
So if it's working for you, you're a doctor. The rest of the doctors need to step up to the plate. Well, unfortunately, we're out of time. So I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. And thank you to my co-host, Siobhan Cronin in Miami, Florida. See you next week. Please continue to tune into our shows for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.